Cut out the ghetto antics. I hate to say it, but it's ghetto. It literally is. You're a nurse practitioner and you are literally going into work with lashes out to here, face in full glam, like you're about to go to the club.
And what about it? Hey, beautiful people, how you all doing today? It's your girl Destiny here, and welcome to my channel. How have you all been? Hope you guys are doing great. So today's video is a very interesting video. It's a nurse calling out other nurse practitioner for coming to the clinic, to the hospital looking like a ghetto. So this is what happened. This nurse came online to talk about how the profession of the nurse profession is very like the reflection of every nurse is a reflection of the profession nursing. And she wanted to talk about how some people cut corners and those people don't deserve to be nurse and all that. She wanted to really say a whole lot of things, but what got a lot of people talking was when she talked about how some nurses will be coming on the internet with a full beat makeup on, with lashes on, long nails, looking like ghetto type of nurses. And people are like, okay, what is ghetto nurses? Because at this point we're confused because someone wear a makeup to the clinic, the person is ghetto because the person has nails on, lash on, the person is ghetto. And we all know what the word ghetto is associated with. If you go on TikTok and Google ghetto makeup, you see the only people that pops up is black women. So we all know the connotation that comes with the word ghetto, that usually ghetto is usually used to associate with black women. And this nurse talking, she's not really fully black, she's biracial, okay? So this really struck an entire conversation of people calling her out. So let's go check out our video, people's response to our video, and then our response to people's response. Anyway, guys, let's go check it out and then we'll come back and talk more.
As a nurse practitioner, I do not agree with all of the trash talking about the nurse practitioner profession, not only from nurse practitioners but also other medical doctors or PAs or whomever. I don't like the direction and focus of the conversation. It's not balanced. And with that being said, I am going to make a few comments. This is a note and message to nurse practitioners out there who are practicing that I find to be, quite frankly, embarrassing. Okay. So just remember that when you're entering into your profession, you now represent all of us. Okay. And with that representation comes, you need to be competent, clinically competent in what you're doing. So if you cheated and skirted your way through your program, didn't gain the knowledge you needed to gain when you were in your practicum before you graduate and all those things, you need to continue seeking higher education. You need to, there's fellowships, internships that you can do. And you should not be even practicing as a nurse practitioner if you know that you cheated your way through. Unfortunately, some of these programs don't have enough oversight to check and find the people who are not actually truly absorbing, learning the material. I do think the clinical sites are underregulated because now nurse practitioners, they have all these programs that help you, companies that help you find a nurse practitioner, but you're paying them to be your preceptor. There's a bias there. If I'm paying somebody to precept me, well then don't they have to kind of pass me? You know what I'm saying? Like, especially if you find them independently and it's not even through an organization. So that's where the corruption's coming in on the clinical training for nurse practitioners, and why you're seeing some of these nurse practitioners come out, they're doing their clinicals with their friends or someone they know, and they're not actually gaining and absorbing the information they need to know to practice safely. That is a problem. I agree. Okay. That's something that the credentialing bodies need to be aware of and need to monitor and need to standardize the clinical training and make the board's exam harder for people to graduate. Everyone does not have the capability to be a nurse practitioner. Thankfully, in medicine, they have science, heavy science, and math courses that weed people out because most people aren't good at math and science. That's the gatekeeping right there. We don't have that in the nursing world. There is no gatekeeping. There's several different pathways you can take, which is a great thing, but also is seeming to backfire because there's some people who really shouldn't be nurses or NPs out there. Okay. So anyway, I say all that to say that for the people who are representing as nurse practitioners, I cannot stand the fact that I'm seeing ghetto providers all over social media watering down any respect that the nurse practitioner profession has. And that's why a lot of nurse practitioners are getting upset. It's one thing to still be learning because you're a novice, you're still within your first couple of years as a nurse practitioner. It's another for you to have the audacity to go on the internet, talk about being a nurse practitioner, and you are literally going into work with lashes out to here, face in full glam like you're about to go to the club, wearing nails out to here while you're treating patients. It is absurd. I have not seen this with any other profession. Like any other medical profession with an advanced degree doing this. I don't see it with pharmacists. I don't see it with psychologists, counselors, physicians, MDs, DOs. I'm not seeing it anywhere else. It's only with the nursing. And I'm like, what is this? I literally was on a Teams call for a hospice company I've been working with, and one of the nurse practitioners came on with a tank top and her breasts hanging out. So unprofessional, so embarrassing. And I'm like, this is why physicians don't respect, some physicians don't respect nurse practitioners. I don't respect you. I don't even care what your title is. I will not respect you in a professional setting if you don't even know how to dress. Dress includes your makeup, the long eyelashes, the crazy nails. That is unprofessional. I'm sorry. It just is. And I think that because there's so many hybrid programs online, these nurses and nurse practitioners are not learning about professionalism because the teacher is behind a computer. I remember one day I was running late to my clinical rotation, and so I didn't iron my coat. And my preceptor was like, she roasted me. And I was a little upset, because I was like, I'm working and I rushed here and I was under a lot of stress already. The last thing I cared about was my coat being ironed. Okay, I didn't think it looked that bad. But she made it very known to me not to ever come to her clinic without my coat being pressed, my white coat. And I appreciate her doing that because that is something I needed to know. Because when we are practicing, we are representing our profession. So I need all of these nurse practitioner students out here flaunting, so happy that they're entering into nursing. I'm happy for you too, but I need you all to do a better job of how you're representing us and cut out the ghetto antics. I hate to say it, but it's ghetto. It literally is. So if you need to Google professionalism, what does workplace attire look like, business casual, whatever it is that you need to research, I need you all to do that. Cut out the ghetto antics. I hate to say it, but it's ghetto. It literally is. You're a nurse practitioner and you are literally going into work with lashes out to here, face in full glam like you're about to go to the club, wearing nails out to here while you're treating patients. It is absurd. I have not seen this with any other profession.
I just feel like we're the only race where we always got to bring each other down. I swear these spaces, MP provider roles didn't get ghetto until I seen more black women acquiring it. I swear we're the only people that have to constantly bring each other down, because I've heard people say little things like this and I know what you mean by that. What do you mean? What's ghetto about wearing a full face of makeup and lashes? Any race can do that. Black, white, green, pink. I've seen unprofessionalism in many different people. That's just professionalism is across all boards, all races. So I don't understand. How is that ghetto, or what do you? I feel like you're trying to say something else in what you're saying, and I hate when people mix a little bit of truth with something, and it just becomes really dangerous rhetoric, because like y'all are pushing this idea, and I swear I haven't seen it until I've seen more black women doing it. Like, yes, now that black women are in these provider worlds, of course she has her hair done, of course she has her lashes done. What's ghetto about that?
And what about it? We wear lashes and a beat face every time. There's a nurse on here that's talking about some nurses and nurse practitioners are ghetto for wearing lashes, their face beat to work, and long nails. You say ghetto, what you mean by that? Huh? I hear ghetto because long nails are automatically thinking a black woman. You got a problem? And was your appearance indicative of the level of care that you're able to provide? When did lashes impair you from being able to give chest compressions? Allow me to continue. Now, girl, if you don't know how to do a highlight and contour and you mad about that, just say that. It seems as if you're projecting your insecurities on black women. I know how long nurses got to go to school to be a nurse practitioner. You're dedicating your life to your education so you can get to a certain level of practice. Imagine somebody being mad at you because you look good. You look like one of them girls that'll come up to you and say, oh my God, your lashes are so beautiful. I love your hair. And be the same one talking shit behind your back. Mind you, she talking about some of the nails but got a whole set. Somebody make an anonymous report. Please, thank you. See all that to say this. Don't come on the internet looking like a regular schmegular female, then coming for the ones that are putting themselves together and performing at the highest level. in every way, shape, and form. Find the business that pays you and stay out of ours.
Is seeming to backfire because there's some people who really shouldn't be nurses or NPs out there.
Okay,
That I'm
yes,
seeing ghetto providers. You are literally going into work with lashes out to here, face in full glam, like you're about to go to the club.
I mean this with all respect, but who actually are you to say that people who went to school for years and earned credentialing, earned licensure behind their name doesn't deserve their licensure and their titles because their makeup is not professional by your standards? If someone doesn't deserve to be a nurse or an NP, let the board of nursing tell us that, right? If somebody is practicing at an unprofessional, unsafe, incompetent level, the board of nursing gets to decide and tell us who doesn't deserve to be an NP or a nurse. Not you, because you don't like how their makeup looks. And this is where I feel like we're losing the plot when we talk about competent medical providers. Just because someone is still themselves and they have an atom of self-expression that goes against the grain of what we've been taught does not mean they are an incompetent medical provider and they don't deserve the credentialing that they spent years earning in school. Just because you don't like the makeup and you don't like big lashes and you feel like it's unprofessional, that has nothing to do with competency. Now, when we talk about nails is a safety thing. Nails is a risk for infection.
Let me just educate you. The word ghetto has a negative connotation. That word dates all the way back to the 1500s. That word was used to describe a certain group of people in a negative way. Fast forward to today, the word ghetto is used to describe a different group of people in a negative way, and that is Black people. I watched some of your video, and some of the things you said I was in agreement with. But the moment that you said ghetto providers, ghetto antics, you shouldn't be practicing if you knew that you cheated your way through. You are watering down any respect that NPs may have. Those comments were a direct blow to the Black community. This is not how you're supposed to use your platform. You stated you represent all of us, meaning nurse practitioners and nurses have to dress professional. I understand. But what you don't understand is that I am a nurse practitioner myself, and you are representing us negatively. You could have delivered your message in a totally different way. There was a lot of tension. There was a lot of frustration. There was a lot of irritation that you have. I don't know if you had a situation. I don't know if you had an encounter with a Black nurse practitioner or a Black nurse. But what's concerning is that you take care of patients. Are you taking care of patients fairly? And I don't know if you know, but TikTok and the TikTok commenters can have your job by the end of the week and make it very difficult for you to get one. You stated, let's raise the bar on professionalism. Well, the professionalism starts with you.
I'm not trying to be messy about that girl, that nurse girl, saying that people who wear lashes, makeup, and nails is ghetto. But when are we going to admit that this lens that we're trying to filter our thoughts through, which I partake in, so I'm not trying to be shady or anything, we're trying to be anti-ists and isms, we subconsciously trust people when they look better and when they present themselves as better.
Yeah.
People are wired to believe that how a person presents themselves is an indicator of who they are. Let me tell you, my son, I'm not going to say what she is or whatever like that. I'm going to chill. I'm not going to be, he had this clinician that was working with him on a continuous basis. Now, she always looked a little fried. I don't have any. One day she came to one of his meetings and she looked like a hot mess. Hair was greasy, clothes hanging off. At that point, I had it. No more. I had to admit to myself, I don't trust this lady with my son. You can't even take the time, a couple of minutes out of your day, to make sure that you have showered, to make sure that your clothes ain't hanging off your body. Why would I trust you to take care of my child, to make my child better? I was like, you know what? I'm going to honor myself in feeling like that. You're dismissed. I'm not saying that people got to look like Nurse Brad. Brad, did she block me? I was searching some of the hashtag and I can't find her. He made one video disagreeing. I was liking some of the shady comments. You know what? Well deserved. You ate that. There's nothing wrong with people who are in any field who wants to look better, because in turn, when you look better, you do better. Subconsciously, all of us, if we seen a nurse come up in there with some dry lips, with the hair just flying everywhere, there's a part of us that is going to question whether that person can take care of you because they barely can take care of themselves, and we don't want to admit that. I know it's a little off topic, but I'm ready for y'all to have that conversation too.
You are literally going into work with lashes out to here, face in full glam, like you're about to go to the club, wearing nails out to here while you're treating patients.
What does that have to do with you? And are these obstacles? Like, I could not find her whole video. I don't know if she took it down or if it got taken down. I just keep seeing screen recordings. So I don't know if she gave more of a reason to why. It just seems like a personal opinion, which everybody is entitled to feeling how they want to feel. But when you feel such a way about other people, I do think that it can graze the lines of being weird. That's just my opinion. If their makeup, lashes, and nails are not hindering them from doing their jobs, why is this a conversation? Just because you want to see nurses that look more of a way that you would prefer. And I feel like we have to be careful when we are trying to advise people to be less ghetto and more professional, because that has undertones to it. And she did acknowledge that in another video, but it's kind of like, sis, you ain't peeped that at first. To be honest, my nurse could be wearing a Michael Myers mask and I would not give a damn. As long as they have good bedside manner, as long as they hear me out, as long as they are doing their job correctly, I could care less about what their appearance is. And I don't know about y'all, but I love seeing the girls that go to work and chew down and eat. I love when their lashes are done. I love when their makeup is done. I love when their nails are done. It doesn't matter what their profession is. As long as they are still able to do their job, I love it. And then she gonna post this. Like this was going to make it better. This is military standard. Military, you're referring to nurses. What? No matter how much of an opinion you have, you cannot make people do what you want them to do. People are not going to present the way that you want them to present. This conversation was pointless because grown people gonna do what grown people gonna do. The same way that you want to present yourself in a way that feels most comfortable to you and that you feel aligns with your job, other people are going to do the same, but they're going to do it differently. And that's okay.
So I'm seeing that a lot of people are getting really, really upset because I used the word ghetto when I was talking about professionalism. And I just wanted to provide some clarification by, what I meant when I said that. So first of all, as a Black woman and where I'm from with most of my friends, and yes, I'm a biracial Black woman. And with my friends who are Black, where we are from in the DMV, we use the term ghetto interchangeably. It's not attached to race. So we might say something is like if my car radio is not working, I'm like, this ghetto radio, like that's how we use the word. So when I was speaking in casual conversation on this platform, that's why I said it that way. It was not intended to be some type of slick way of targeting or talking about specifically other Black females. So my goal here is not to tear other people down, but my intention was to say I'm trying to protect our profession. And I think that all people, all women, you should look your best, absolutely. And I obviously can't tell people what to do. I'm just voicing an opinion here. And I love long nails. Yes, I do have on long nails, but I don't wear these to work. Like if I'm going to go see a patient, I would not have these nails on. And I love full glam. I love dressing up too and looking nice, but I also know that when I'm in the work setting that I change how I dress and present myself, especially when we have a diverse patient population, right? So I 1,000% understand why people are upset, but I need you all to also know that I would never try to tear down other Black women. If anything, I feel like a lot of people are trying to tear me down by telling me I'm not Black or telling me they don't consider me part of the community, which I think is way more messed up than me using the term ghetto when I was actually talking about a ton of nurse practitioners of all different races. It was definitely not directed to one group of people. So anyway, that is all. I support and I love my community. Even though people are saying some things towards me, I get it. I just wanted to put a disclaimer out there. Also, I wanted to thank everyone for the folk who gave constructive feedback and the people who reached out to me privately and agreed with what I was saying and understood what I was saying, and didn't take it out of context like a lot of other people did. So I appreciate y'all quite a bit. Thank you, everyone. And I hope that this video gives some clarification, but I'm sure you all will probably find something wrong with what I said here too, based on my TikTok experience so far.
Ciao. Please let me know what you think about this video, this conversation down in the comment section. But as always, please keep it respectful. You're on this channel, we're allowed to disagree, but we'll do it in a very respectful way. So go ahead, feel free, share your thoughts. So talking about nurse practitioner and all that, for me, the fact that she came back to clarify things and in a more shady way, for me, I don't really appreciate it. I personally, I don't like when women are out there judging other women what they choose to do with their body. And I get it, when you're in a professional settings, there are certain way you should dress. But anyway, let me know your own take down in the comment section. We're here to just have conversation. We don't tussle here on this channel. We're allowed to disagree, okay? Like I was saying, I don't like it. I personally, I don't like it when I see a woman judge another woman because of a style watch. I don't like it. I don't like it. And I feel like, especially the times we live in now, is that, especially these people that do this clean girl look, a lot of them feel like they are better, especially the ones that has good skin and all that. They feel like they are better than the rest of the people that does makeup or loud nails and all that. They feel like they are better. I'm telling you, yes. And I do get it. When it comes to professionalism, there's certain way you should present yourself and all that. Like 100%. You can't come to the hospital looking like you're going to the strip club. Like every profession has its own code of dressing and all that. So if whatever a nurse is wearing is not against their code of dressing, then why is that your problem? And I understand the nail part. I personally, I would like a nurse wearing a whole long nail. I will give you the side eye, like, why are you wearing long nail? Because you're going to be touching different things and all that, things moving around. I get it. But full face of makeup, even here on this channel, a lot of you guys like it when I have a full face of makeup, when I look, whether you like it or not, especially as a black woman, when you have a full face of makeup or you look put together, you intend to command more respect than when you look like you didn't take care of yourself, you just pack your hair and then show up. So when other women are putting more effort to the way they look, which, because whether you like it or not, society take people that put effort into their look serious. So when other women are putting themselves together, you are complaining that the lashes is too long. How is that even your business? I don't like it when people make what other people choose to do with their life their business, especially when it does not affect you, or it does not even affect the profession. If it affects it, the board of directors will probably call those nurses in order and say, oh, you're not allowed to wear these lashes, you're not allowed to wear full makeup. But it's not affecting it, so I don't like it. I see women that does this very catty, and that's not even my energy. That's not even my style. I don't like catty women. I don't like women that likes yapping about other women, what other women choose to do. If you don't like, if that's not your style, that's not your cup of tea, let it go. Anybody that knows me know that I'm a very black, white, gray, nude type of girl. That is me. And I have friends that the only thing they want to wear matching color, they want to wear loud color, and it's fine. I can say because that's not my style, or then, oh, it's an ugly style, it's distasteful. Because it's not your style, it's okay. It's okay. Stop saying because it's not your style, then it's distasteful. And that's one thing I've seen with catty women. Because it's not your cup of tea, whether it be clothing, whether it be opinion, whether it be, then I say, oh, it's not tasteful. It's not tasteful. Oh, come on. Why are you fighting with other women? Why are you testing with other women? Why? It's not your thing. It's fine. If it does not affect the job or the other woman doing her job, especially in the healthcare, and I get it, the way you look, all that is very important to the care you're providing. I get it. But if it's not obstructing the quality of care these nurses are giving, why is it even your problem that they wear lashes? Why is it even their problem that they had full makeup on? I get somebody to always say, because if you guys don't know, I love perfumes a lot. I'm that type of girl. I love to smell good. I love when I walk into a room, people are like, I just love the smell of, like, I just love smelling good. And I have somebody, I won't call her a friend, an acquaintance that said that, oh, your perfumes are too harsh. That, how does that affect you? I don't like people like that. I don't like, no, I don't like women that try to talk down on other women. What? No, I don't like it. Oh, the hair is too big. I get it when you're giving constructive criticism and like, oh girl, oh, this type of hair will frame your face. Oh, like, get it, but not like, please. Anyway, she has cleared the hair. Okay. Just let you guys let me know what you think. Okay, share this video with somebody that you want to be part of the conversation, because that's what we do here. We have banging conversations. So go on and share this video. Don't forget to give this video a thumbs up, smash the like button, because this helps YouTube to push up my content for more people to see, and that'll be you supporting this channel and this guy. So go on and do that. Subscribe if you haven't subscribed to this channel, and I'll see you guys in my next video. Deuces.